Oh. Hi, everybody. We're going to call our meeting to order. So we're going to start by recognizing that we are holding our meeting on the unceded traditional territories of the Sushot and Hupachesset First Nations. And welcome everybody and thank everybody for coming. This is great. We hope that you come to all of our regular council meetings. We have an agenda in front of us. Would somebody like to move approval? Is there a seconder? Second. All in favor? Thank you. Okay, so before we adopt our minutes, I just want to let everybody know that today's meeting is a committee of the whole meeting. So if you haven't been to a committee of the whole meeting before, just to give you a bit of an idea, this is a meeting where we're a little bit less structured. Our intent is to hear from the public, have more dialogue with council, and we're not going to end up making a decision at the end of this meeting. We're going to take it to a future meeting of council where we will discuss and make a decision from there. But we really want to take the opportunity at this meeting to hear from as many of you as possible. So this is really a dialogue and information gathering meeting. And just to remind everybody as well, this meeting is focused around discussion on retail cannabis. So while you may want to get into some topics around production and that kind of thing, it's not the intent of this meeting, although it's an important discussion to have. But we want to focus as much of our conversation today around the retail side of it as possible. Okay, so item B, adoption of minutes. We have minutes from the meeting held at 4 p.m. on April 16th, 2018. That was our last committee of the whole meeting. Would somebody like to move approval of those minutes?
So moved.
Okay, is there a seconder?
Second, Madam Mayor.
Any questions on the minutes? All in favor? Thank you. Item C, correspondence. City Clerk, please.
Madam Mayor, we just have 3 items of correspondence that were received for the agenda. One is from the Ministry of Attorney General advising of the role municipal governments can take in the issuing of a cannabis retail store license. We have an email from Bill Young expressing concern regarding recent construction in his neighbourhood and the possibility of a cannabis production and sales facility. And also a letter from Janice Sheehan expressing concern in regards to the Port Alberni Cannabis Club on Butte Street.
Thank you. I don't see on here moving receipt of our correspondence. Do we need to do that or do we do it at the next?
They can be received now,
Okay.
Madam Mayor. Yeah.
Okay. What's that?
Madam Mayor.
Second? Any questions on the correspondence? Comments? Okay. All in favor? Thank you. Okay, so item D is staff reports. And just so that the public is aware, we are going to have a presentation or a couple of presentations from staff to put a little context to what we're talking about. We will have questions at the end of that portion. So CAO.
Madam Mayor, the city's manager bylaw services, Flynn Scott, would like to summarize a report that he jointly wrote with the city planner, Joe Calenda. And I believe he's got a PowerPoint he'd like to walk us through as well.
Thank you. And there's a couple more seats at the front if people want to come up and squeeze in. Okay. Thank you.
Councillors and members of the public. I'm just going to give a brief summary on the report that was written on November 14th to give some background context to today's discussion. Oh. If this is going to work. All right. So as an overview, I'm going to go into the background section of my report, which focuses on current bylaw provisions in place regarding medical marijuana dispensaries within Port Alberni. I'm going to talk about national legalization of cannabis. I'm going to focus on federal and provincial legislation and recommendations. In my discussion section, I'm going to go over local government's powers and authorities in regards to retail cannabis businesses, location considerations that a local government can have, proposed bylaw regulations, and important legal considerations. I know no decisions are being made today, but there's some important legal considerations that need to be made when choosing to amend or adopt bylaw provisions in regards to retail cannabis. And then finally, at the end of my presentation, interim city planner, Mr. Joe Calenda, will discuss the planning perspective of retail cannabis businesses within a local government. So moving into the background, Under our current City of Port Alberni bylaw provisions, under the zoning bylaw, there's 4 pre-existing commercial zones. So your C2, C3, C4, and C7. Currently, our medical marijuana dispensaries were added as a permitted use under each of these 4 zones. And additionally, previous bylaw provisions were adopted, which restricts 1,000-meter setbacks in regards to similar business proximities. Under the business license bylaw, general provisions were established containing hours of operation and overall general site management of a medical marijuana dispensary in Port Alberni. It's important to note that a total of 4 business licenses were issued for medical marijuana dispensaries to operate in 2018. And so I provided here, it could be a little confusing at first, but I've provided a map here that I'll walk you through. So your orange, pink, salmon, and red zones are your core commercial zones that you have, the 4 zones I mentioned for commercial. If you look at the green circles, you'll see 4 of them. So what that is that's that 1,000-meter restriction that exists currently for medical marijuana dispensaries. And on the top right-hand corner is an orange circle, which is basically one zone left in regards to that 1,000-meter setback where a potential medical marijuana dispensary could be located. The reason I'm referring to medical marijuana dispensaries in my presentation is that there was a report on August 29th from the Director of Development Services, Scott Smith, recommending rolling over those provisions and applying them to retail cannabis businesses. And my presentation today is going to make recommendations, although no decisions can be made, recommending that we start fresh with provisions based on the new information we have from provincial government and the methods they're proceeding forward with their regulations. So national legalization. So as most of us are aware, on October 17th, 2018, cannabis became legal in Canada. And the Liquor and Cannabis Regulation Branch, or the LCRB, has basically tasked local governments to provide input on provincial applications received. So a local government has 2 options. They can choose not to make a recommendation on a provincial application, but that application will be denied by the province if we choose not to comment. A local government can choose to make recommendations or comments in 3 methods. They can, based on a case-by-case basis of the application, they can choose to receive input from local residents in the surrounding area and how they can be affected. They can choose to deny the application, or they can choose to approve the application. The important part here is that the provincial government will never issue a business license, or has stated that they won't issue a business license if a local government doesn't approve that application. Vice versa won't be said, though. So if a local government chooses to comment and approve a provincial application that receives recommendation, that doesn't mean that the province is going to approve that license. They have ultimate discretion on whether to and whether that business meets that criteria. So under the discussion section, what are the powers that a local government has in terms of retail cannabis businesses? So the LCRB grants local governments the following regulatory powers. 1, they can impose restrictions through zoning bylaws in terms of location and setback considerations. They can regulate terms and conditions of the store in terms of business licensing, hours of operation, and they can allow a local government to charge applicant fees for cost recovery. There needs to be a rationale for the fee price we set for that license, but we do have the power, or a local government does have the power, to impose a higher fee to a business license. And so this is an important one in terms of considering a location for retail cannabis businesses in Port Alberni. And so the province has basically given a local government 3 discretions, and different models are being used across the province, and it's left up to the local government to determine which one they choose to follow. So in determining a location, you can either 1, permit a site-specific rezoning application on a case-by-case basis. 2, you can zone through a temporary use permit, or a TUP. Or 3, and this is the method that staff will be recommending, you can add retail cannabis businesses as a permitted use in commercial zones. So very briefly, I just want to go over what the pros and cons of each model would be for a local government. So if you allow site-specific rezoning applications, the pro to this is it allows maximum control of permissible locations, and it's maximum control of industry growth. The cons to this is that it's extremely time-consuming on process and staff resources, and it's a disincentive for economic growth. And to give you an example, if the province received an application from a person wanting to get a provincial license, it would go through the check marks that the province has set out, and then it would be referred to the local government for input. And at that time, if we chose this model of rezoning, we would basically have to put that on hold so that a rezoning application could be submitted for that site-specific zone for the applicant. At which time, if that rezoning application was approved, staff would then have to prepare a report giving council and the local government consideration on that retail cannabis business license to the province. It would have to go back. It's very time consuming. It would require going to council a couple times at least, and it is a disincentive. The second option would be to zone through a temporary use permit. Very similar to the first model. The pro is it allows more control of permissible locations, more control of industry growth, and a third pro is that it allows flexibility. So unlike the rezoning application, it could be that site location has a 3-year trial period, and you can place conditions on a temporary use permit. The con, again, is that it's extremely time-consuming on process and staff resources. And again, similar model, it would take that 2-part process where when the application is received, staff would have to prepare a report, and a temporary use permit would need to be applied for. It's expensive. There's associated cost to that. There's OCP prerequisites. And keep in mind with these first 2 models, if the local government chooses to approve, think back to what I just said a few slides ago, where it doesn't mean the province is going to approve it. So we might put people through this rezoning application and this temporary use permit application, give our approval, and then find out they don't meet other provincial requirements, and they're therefore denied. And so they kind of went through that process unnecessarily. So the third option, and the recommended option that staff have, is to add as a permitted use. So retail cannabis businesses as permitted uses in those 4 commercial zones. The pro to this, it's a high incentive for economic development, and it's less demanding on both staff and council. So basically we'd set the framework by amending the bylaws, adding it as a permitted use in our zones, and then creating business license conditions for that specific classification of a license. The pro is that it doesn't have to go twofold back and forth. We could have the framework set out so that when an application is received by the province, a report could be prepared, and council would have those 3 options to either allow, deny, or comment on that application based on meeting the criteria of the bylaws. Like any model, there's cons. This one is it allows less control regarding site location. For example, if you add it as a permitted use in a C7 zone, then most C7 zones will meet that criteria if they meet the bylaw conditions. It doesn't take away control from a local government or council in the sense that each application is a case-by-case basis and needs to be brought forward for input to the province. And the only other con, well, I won't say that, but another con is that it creates legal nonconformity of land. So if you allow and approve a license application in a specific zone, a C7 zone, and 10 years down the road, it's no longer wanted in that zone, there will be lawful nonconforming entitlement to that site-specific location. So recommendations, again, I'm aware that this is just educational today, but staff are recommending to allow in all 4 commercial zones and to not restrict setbacks to similar businesses. This is a process that the province has been quite thorough with, and it's regulated on a provincial level through the LCRB, and it follows a similar model to liquor outlets. So there's also consideration on setbacks to schools or in proximity to minors, and I'll just flip slides. So again, not looking for direction today, but just educational, just to make you aware, those little blue circles, if you can see them, those are 300-meter setbacks from schools. So you can see while it does overlap in some commercial zones, it's significantly less invasive than establishing 1,000-meter setbacks from similar businesses. By that 1,000-meter setbacks, if you were to maintain those and roll those over into retail cannabis businesses, we'd be restricting to 4 or 5 developed locations within the city of Port Alberni, as opposed to just abiding by those 300-meter setbacks where we could focus on having these retail businesses in commercial areas. And so under the business license bylaw, the province has recommended specific hour, well, they've set hours of regulation from 9 a.m. to 11 p.m. and staff are recommending to follow the provincial model and not go any stricter than that. Province is also recommending that bylaws include proof of provincial and federal certifications and ensuring that they're compliant with those provincial and federal regulations established. And once again, this will be a discussion at the future council meeting, but it's important just to have in the back of your minds, in terms of the zoning bylaw, that staff will be looking for input in terms of clarity on which zones to permit or which model to follow, as well as proximity, if any, to similar businesses, proximity to minors or schools, and what that framework looks like. A lot of municipalities are focusing on 100 to 300 meter setbacks, but it's completely discretionary. And finally, the province highly recommends provisions in your zoning bylaw to hold property owners accountable. And what that means is typically under business licensing, it's the business license holder who's responsible or held accountable, can be ticketed or taken enforcement action on. Under our business license model, it does require property owner permission if you're not the property owner to make sure they're aware that business is being conducted on their site. And so the province has strongly recommended that if there's any issues, that the property owner is also held accountable for the actions taking place under that license. And finally, my last slide is just important legal considerations that need to be considered when choosing to amend or draft new bylaws in regards to retail cannabis businesses. So the province requires council's input on a case-by-case basis. And so regardless of if a similar model appears, it can't just be stamped off the same as the previous application. It needs to be brought before council for consideration, and council needs to choose to deny, allow, or comment with recommendations. The one strong point I do want to make is that a local government is not permitted or should not permit to allow that either or model with public or private. And so there's been legal opinions spread across the province, and the ministry has stated as well that in the early stages there was discussions about you could have a provincially run store or only provincially run stores and private stores. And it's since then been strongly recommended against. And the rationale is that you'd be regulating the user and not the land use. And so you always want to regulate the land use and not the particular individual. And so finishing with that, I'll pass it off to Joe Kalinda.
Thank you.
Thank you, Mayor and Council. In looking at this issue, we've looked at cannabis retail as a legal and regulated use in Canada today, after October 17th. So we have suspended our judgment on whether you should or should not use it and this and that. We've tried to focus strictly on the city planning of all this. And in that case, we've tried to decide, well, if we're going to have cannabis retail as a legal use, where do we want to put them? And our recommendation, of course, is that they be permitted in Southport, Northport, Johnson East, and the Redford commercial area. And we'll be doing an amendment to the zoning bylaw to sort of lay all of that out. There's 3 days that are really important in this whole business. There's October 16th, October 17th, and October 18th. And on October 16th, we had 4 medical marijuana dispensaries operating legally in Port Alberni, legally under our zoning bylaw and under our business bylaw. Whether they were legal uses under the laws of Canada or the laws of BC today is kind of a moot point. But in fact, on October 16th, they were legal uses, legally zoned with business licenses in Port Alberni. On October 17th, Canada passed the new regulations which permitted cannabis retail just about anywhere in Canada, subject to provincial and municipal regulations. On October 18th, we still had 4 marijuana dispensaries operating, and while they were technically legal under the laws of Port Alberni, they were technically illegal under the laws of Canada and under the laws of BC because they did not have a BC provincial permit or provincial license to operate. So now there is a process in which anyone who wants to, who wants to retail cannabis can get a license from the province, and soon they'll be able to get zoning permission and a license from Port Alberni to do so. So that's been our orientation now is, where should these go? And we say, as city planners and staff, we say you ought to amend the zoning bylaw to allow them to be located in Southport, Northport, Johnson East, and Redford commercial areas. And then we're probably going to be recommending a 300-meter separation distance from schools. And I just want to reference the letter from Pam Craig, school board chair. In the last paragraph, it says, as schools and school districts take an active role in advocating for the health and well-being of students, we must consider the impact of the marketing and normalization of cannabis use on student behavior and their beliefs regarding the safety of cannabis. We urge Port Alberni City Council to consider the impact of proximity on health-related choices with the needs of youth as a key consideration in ensuring that students are minimally impacted by cannabis retail operations. So, in response to this, which is a very legitimate concern, in response to this, we're probably going to recommend a 300-meter separation distance between cannabis retail and schools. However, you must understand that this is more of optics rather than harm reduction. Whether you go 300 meters or 500 meters or 1,000 meters, and we're probably going to recommend 300 meters, the students at ADSS or everywhere else, they have 2 feet and a heartbeat. So if they want to go to the store, it doesn't matter if it's 300 meters away or 500 meters away or 1,000 meters away, they'll go, because that's the way people are. If you review the American Surgeon General's report 2015 on the use of tobacco and tobacco-related products, you'll realize that over the last 50 years in the United States, there have been 4 classes of initiatives to sort of help people stop smoking or encourage people to stop smoking. One of the initiatives has been what we know as a clean air bylaw, which is essentially an anti-smoking bylaw that says you can only smoke here, here, and here, and you can't smoke here, here, and here. And what the Surgeon General's report indicates is that that particular class of initiative, out of the 4 classes of initiatives to get people to stop smoking or not start, that particular initiative, telling people where they can or cannot smoke, has been the least effective in discouraging people from smoking and so on, okay? So it's the same thing here. Like whether you say 300 meters or 500 meters or 1,000 meters, it's much more effective if you tell students and everybody, smoking tobacco is harmful for you, or smoking marijuana may be harmful for you, and then you make your own choices. In any event, I think probably our recommendation is going to be 300 meters, but it's up to council to decide. You can choose whatever you want, okay? So those are my comments for now, and if you have any questions.
Thank you very much. We will open it up to start with council questions. Councilor Washington.
Thank you, Madam Mayor. Just the planner's comments about the 300 meters. Also, there will be a age restriction too, so most students going to ADSS won't be old enough to get in there anyway. Yeah,
that's true. I mean, this is a legally regulated retail operation. It's regulated like alcohol and tobacco, and I think in all cases you're supposed to be 19 or older to consume. Yeah.
Thank you. Councillor Solda.
Yeah, my question is, who's going to monitor all the regulations? I mean, we're short-staffed and we have trouble with other monitoring of other issues. So who would be the monitor of this? Is this going to... But
Come on.
Thank you, Madam Mayor. So the province has established enforcement units that will be responsible and dispatched across British Columbia. They will work in collaboration with local governments, so that could be the local RCMP providing information, or the Bylaw Services Department and Business Licensing Department providing information if necessary. But in terms of our own bylaw regulations, it would be the same as any other business. There's conditions of your business license and regulations in place that you need to abide by, and failure to do so will result in the suspension or revocation of your business license, like any other business.
And may I ask another? And so, like with our liquor stores right now, I mean, they're in different zones and different areas of the city. So you can't open up another liquor store. You have to have a distance between each one. And so how will this work with these dispensaries?
Yeah, well, not dispensaries anymore. Like
Okay.
medical dispensaries are now
Terminology.
redundant.
Okay.
The only thing we're talking about is cannabis retail.
Okay.
And it doesn't matter if you retail for recreational purposes or medical purposes, it's all the same now.
Okay.
So we are not recommending any separation distances between cannabis retail stores. I don't know why we'd want to do that anyways. It's simply a market decision, it seems to me, how many cannabis retail stores come into Port Alberni. And from our perspective as a land use, there's really no difference between a cannabis retail store or a clothing store or a food store. Really, they're just retailing a product. So we would tend to use the same criteria for them as we would use for any other kind of retail store. Now, I do acknowledge this product is legally regulated and age restricted, but it's still a retail store. That's really what we're talking about at the end of the day.
So the liquor stores wouldn't be the same category then?
No, the liquor stores have another criteria that do not apply to cannabis retail, as far as I know, in terms of separation distances, you know. And my recommendation as city planner is you don't need separation distances between cannabis retail stores. There's no good reason for it.
Okay, thank you.
Councillor Corbeil. And just a reminder to the public that we are going to get to public input, so don't worry about putting your hands up yet.
Thank you, Madam Mayor. This question, I believe, is to Mr. Scott. I think what you said was you're advising against public and private businesses competing against one another. Probably many of us seen the one government store in Kamloops, which looks very similar to, an Apple store, and quite an attractive-looking store. Am I reading you right that you're advising against that? And if we were so inclined to ask the government, what's the process for a government-run marijuana store?
Sure. So, Madam Mayor, let me provide clarification. I'm not proposing to go one or the other. I'm recommending to go both, if that's the option. Don't go all private or all public, because you'll be regulating the user, not the land use. But I'm certainly not against a provincial store coming in or recommending against that. It's just don't do one or the other and say you only want provincial or you only want private.
Any more council questions? Councillor Poon?
This question is for Mr. Kalenda. So based on your recommendation on 300 meters, what is the difference between having 300 meters and 0 meters? I mean, it doesn't seem like there's any difference.
Yeah,
because
I think a very good question. I think what I started saying with this was that it's really a matter of optics more than harm reduction. So if you have a 300 meter separation distance, then it is the optics of it all. But and maybe the chair of the board might have a different view of this, but really I don't think separation distances are going to change behavior a whole lot. They're going to do what they're going to do, and so for me this is really more of optics than actual harm reduction. And so that's why it doesn't matter whether it's 300 or 500 or well, it matters if it's 0, because 0 means there's no separation distance. Yeah. Okay.
Thank you. Councillor Haggard or Paulson, any questions? Paulson?
I'll just make a quick comment. And when we were at UBCM, council met with the minister responsible, and actually the presentation was a fairly simple one. As of the 18th, all bets were off. Period. Anything that was operating, whether it be under our business license or not, was at that point in time illegal to operate. And they indicated it's up to the municipalities to decide the number. They could municipality could say we're going to regulate that we have 0. Yep. They could regulate that we have 1, or we could regulate for applications based on reception of the application and the bona fide of that application. So really what they indicated to us, and I think it behoves the industry and for councils and municipalities, gives us the opportunity to start from scratch and start to build this cautiously and I think judiciously, and hopefully wind up with the right formula. I mean, we're a community that takes a big hit for the number of liquor stores we have in our community. We want to make sure that we don't have 20 retail cannabis stores, and we get labeled with that as well. So I don't know if anybody wants to add to that conversation that we had with the minister, but you know, a couple of the meetings that we went to, ABICC, the Association of Vancouver Island and Coastal Communities, I was a little bit disturbed when they had representatives from the federal government, the provincial government, that didn't have answers for us. And it indicated to me that they didn't have the process nailed down right to the finite points. And there was lots of things that they didn't have the answers for us when we asked them in committee there. And so we want to be cautious, and I think that if we do this right, it's legal. So let's deal with that and move on. Thank you.
Thank you. Councillor Haggard.
Thank you, Madam Mayor. You may not have the answer to this, but my question is, I'm wondering why the provinces that bring in their own provincially run cannabis stores, why are they offloading it to the municipalities?
Well, I think there's been a general offloading because I think the province for a number of years now, for example, has been providing for private liquor stores. And I think it's just more of the same, but that's my answer anyway, so, yeah.
Thank you. Before we go to public input, I'm wondering if our RCMP representatives have anything they want to say? Nothing to add? Okay, wonderful. Just want to make sure you're sitting back there in case you have a comment on it.
Put the handcuffs away, so.
Okay, we will open it up to public input. Would anybody here like to speak? Come on up. So when you come to the microphone, do make sure that you speak into the microphone, and if you're able to just identify your name and your address for the record, that would be great. And then I'm just going to ask everybody as well to please be cautious of everybody else's time. We want to get to as many people to speak as possible. So we're not going to put a hard limit on people's time, but just be respectful of the fact that there could be a lot of people here who want to speak.
Okay. My name's Gary Spooner. I live over at 3225 10th Avenue. I'm a user of marijuana, but I get it issued to me by the government. It's I deal with I have a stress problem, right? So they've been issuing marijuana, and I've been using it since I'm 48. Now I'm 56, and I was a new user at that point because I was working military aircraft, and I just wasn't available to use it at that time. So what I can tell you about it, just from the point of view of a person who's new and my age and stuff like this, is that, well, it's done its job. I nearly committed suicide in 13 as a result of my stress, and the marijuana certainly did help. I've never had a bad reaction to this stuff. No headaches. I don't even have the urge to go and get this stuff. Matter of fact, I've just forgot my prescription. With regard to alcohol, there's a whole lot more trouble with alcohol. You have your parties, you feel terrible the next day. I don't feel like that at all, okay? I'm just giving everybody here some thought about that because from the point of view of people around here who have anxiety, even in recreation use, they're gonna benefit from it. Not only the pizza stores too, because you get hungry. And you guys might find it a whole lot better to deal with as well, because people are just going to be, well, quieter, calmer. It really does have that benefit. But I'm ex-military. I was on the F-18 for a few years, and I was also in the Army, and I worked as a vehicle technician in the Army as well. But with regard to stress, it's probably the most effective and the fastest control for stress that I've found, and I think it's probably a good idea. I think alcohol should be gotten rid of. It's just a pain. This stuff is not. So that's it.
Thank you very much. Councillor Paulson.
Gary, just going back with regards to your prescription, and you actually went through the federal government
Veterans Affairs.
the channels.
Yeah.
Where did your prescriptions come from? Did they come from Tilray or one of the other federally regulated companies?
Well, I'm with the OSI clinic in Vancouver, which is the operational stress injury. I get a psychiatrist who prescribes marijuana.
Yeah.
Okay. And what he evaluates my symptoms, etc. And I have other psychiatrists who are also helping me out as well. I've had it renewed again for this month, January, February, probably going to end up March, but I haven't really felt like I've needed it. So in other words, I've just not used it. So you don't get the alcohol addiction. You don't even get I don't even get that kind of a problem with marijuana, right? So I'd prefer to see it in edibles, for the point of view of a smoker. I'm not a smoker. Edibles is the best thing. Just be careful. Some of it can be really potent and get you. But especially people who drive. Anybody here, if edibles, don't do it. Stuff is sneaky. Don't do it.
Not from experience, though, right?
Oh, I've used the edibles.
I know.
Oh, yeah. But I don't know. No, that goes without saying, right? But as a medical user, and in my situation, it's been great. It's a benefit. So we all know what alcohol's like.
Yeah.
You want to
But I
have
appreciate
a
that
referendum to get rid of that?
you've gone through the right channels for your prescription, and
Yep.
think about the prescriptions is you know what you're getting, and you know strength and those sorts of things. So good for you. Thank you for sharing.
Oh, yeah. You're very welcome.
Thank you.
You left your thing up here.
Sure.
Hi, Shar Patterson, Shar's Landing, 4815 Argyle Street, and thank you very much for giving us the opportunity to speak. I don't have a lot to say other than some of you may recall that I went through a 4-year process of applying for a liquor license, a liquor primary license at my place, and took a lot of input from the community. It was a long process, but it was regulated by the BC government's, well, now it's called Cannabis Control and Licensing Act, and the BC Liquor Distribution Act. They are government-run groups that are mandating where liquor establishments can be, whether they be private or whether they be public or any type of retail. I disagree with Director Planner very strongly in that this isn't just some kind of retail, another kind of retail. I'm zoned for retail at my building, but I'm sorry, cannabis is for minors must avoid the location. It shouldn't be near where minors congregate. That's our responsibility, and the BC government is mandating that. And they already have guidelines in place for liquor, and it seems to me, I believe, that they're just using those same guidelines for cannabis. So why, as a city, would we do anything other than start with our guidelines for liquor? We could just copy those guidelines over to cannabis and start there. So, and there are a lot of rules. I think 1,000 meters, and you have to allow the approved permitted use, site-specific permitted use. Why would we start anywhere other than what the liquor license laws are? That's my question.
Thank you. I'm wondering if we might want to comment on the differences with our liquor licensing and how that process works from the municipality's responsibilities.
I think it's going to be a judgment call on council whether you want to treat liquor and cannabis exactly the same. I don't think they are. I think liquor is what it is, and cannabis is more like tobacco, And I think I don't think we have separation distances between grocery stores that sell cigarettes or smoke shops that sell cigars or whatever. So I do think marijuana is closer to tobacco than it is to alcohol or wine and spirits. So that would be the difference for me. It's still a legally regulated product, and it's legally regulated by the province, not by the municipality. We regulate the location of it. We don't otherwise regulate it. So I think that's the difference, but. Excuse me.
Sorry, may I just respond?
Sure.
There's a huge difference between tobacco and how we are regulating tobacco versus cannabis. Excuse me, Director, Planner,
Kalinda.
Joe, I apologize.
Just Joe.
But there's a huge difference in that all the stores, all the retail outlets were selling tobacco. For many, many years, for many generations, they were selling tobacco. And now, as we have learned the outcome or the problems with tobacco, we have now tried to regulate where tobacco is being sold. That's a big difference. So right now, in the few grocery stores that do offer tobacco, they have to hide it from the minors. That's a big difference. Now, we have the opportunity to start fresh. We're starting with a very important, there are a lot of people here who are using cannabis for very good reasons. I'm not against it. I'm not a user, but I see its benefits. But we can start from scratch, from the very beginning, and we can say, how do we want to implement it? So we look at what's working now in our city, and I believe what is working is how we are distributing alcohol. I live that right now. I am distributing it in a very conscientious way. And so we can start now with what works. I think how we do liquor is working right now. So that's my recommendation for what it's worth. Thank you.
Thank you. In the back.
Hi, my name is Brent Knox. I think we have a unique situation here where if we put these cannabis shops somewhere, let's say uptown, okay, we create a synergy. Tourism, we're always talking about trying to get a few of those million people going to Tofino and Long Beach. Very difficult. By doing this, we have to put out very little money, and we will have literally thousands of people go up there. You can call it whatever you want, from a Little Amsterdam to the New Amsterdam. I know it sounds funny, but I'll tell you right now, Port Alberni will be better served by doing it that way than sticking them willy-nilly. Northport, Southport, Johnson, here and there. And I think it's something that we should be looking at. That's really all I have to say.
Thank you. Aaron?
Hello, and thank you, Ms. Mayor. My name is Aaron Breivik, 2840 Highmore. Just have a couple of questions here. Quickly to the last gentleman, appreciate the idea. Good input, bad input, all inputs required. However, I don't think you can find any liquor stores, as this is the same department that are licensing these. Liquor stores don't operate next to liquor stores next to liquor stores. They just don't allow it, and I'm pretty sure they won't allow that in the licensing of these either. Even if you guys allow people to apply side by side by side, I cannot see the government just saying, 40 stores, let's do it. It's going to be a really hard sell. Just another quick one for you, Ms. Haggard. You had asked a question about why the government stores are open. The government was legally mandated to provide a service to the public. That can be one store. Doesn't have to be 100 stores. However, for them to do so in a timely manner is a lot easier than to, say, regulate someone like myself, who will have to go through an extensive background process. That is why the government stores will and probably should open right away as they introduce other retail sales. Yeah, no problem. Sorry. Okay, so I just had a couple things. I don't know, this has been a hot topic here, but just real quick to Joe, I like a lot of the stuff he was saying, but there should be no dispute about this. The man from the military that was up was discussing medical cannabis. Medical cannabis is medical cannabis for a reason. It's often irradiated to prevent the spreading of bacteria and stuff. Medical cannabis is medical cannabis. It's grown in million-dollar facilities by companies that have spent millions of dollars to have the right to do so. I've been saying this for years. This will be the first council that actually issues proper legal licenses to sell cannabis, be it retail, be it whatever. But there are no storefront sales of medical cannabis anywhere in Canada. There never has been. That's just been a bit of a fallacy, and it's okay. Mistakes are often made in error, but the intent is good. Let's see. Children, I just wanted, with the temporary use permits that were brought up at the beginning of the presentation, really good. I really like the way it was presented with all the pros and the cons against like how council can go about this. One of the ways that it came up was the temporary use permits. That's a tough one for me because a lot of these businesses require, again, this would also be touching on production. These are very expensive. Temporary use is going to be a hard sell for a business to set up, requiring investors, this, that, and the other thing. Also falling on the owner of the building getting the permits. Because if the guy at the meat shop starts buying fish off me and sells illegal fish, I fish a lot, that shouldn't go back to the owner of the meat store. But that's not what I can do. However, on October 17th, when these licenses came into effect, analytical testing, nurseries, micro-production, research and development, and micro-processing also became available. If we are to go on with the lengthy 3-month process, or however long this is, for each one of those applications, you guys are going to have a full-time job, and you will be cannabis experts. Welcome to come work side by side with me anytime. It's going to be a long and informative process, and frankly, I believe you guys have a lot more important things to do. It would be a lot easier, and I have a problem with the process in which this goes. You guys have, as planners, done a lot of work, and it's much appreciated. Very informative, very well put together. It would have been nice if the public input period was allowed to be presented prior to the forming of the planning department's issue, because my understanding is the council will make a motion to accept the review put forward by the planning department. It would save time, it would save money if this just included everything that became legal for usage, because the government has so many requirements for building uses, for so many things. You will not get production facilities everywhere because you need a chain link fence all around them. Well, if all your commercial buildings come right to the sidewalk, they don't qualify. There's a lot of things that you guys aren't fully aware of in the thing, and I don't want to, like a business that I'm trying to start, to take another 6, 9, 12 months to jump through all these hoops, when at the end of the day, we could really just adopt a permitted use policy for these, with the exception of standard cultivation, which would be like a Walmart-sized facility. ACRD recently said no to these facilities because of smell, not understanding. Somebody also brought up and has a presentation about medical things. Anyone currently operating under the MMAR or the ACMPR doesn't require ventilation with their smell. Smell away. Your restaurant smells, your body shop smells, there's going to be smells. However, all federal facilities have a very extensive inspection and expensive restriction system around their ventilation, and they don't smell. So I just thought it should be mentioned that while the temporary and permitted uses, that's a great idea, it would be really good if the public input was allowed on that and the city planner had time to review that and possibly even include those uses, so the city could just adopt that motion and not have to have, if we spend 3 months or have another one just on analytical testing, I don't know a lot about that. I would like to, but it's going to be a long open format to the public, and you're going to all be asked to come back. Again for production, again for processing. If somebody opened up a processing facility in town, that's just where farmers send their products to be packaged. Just a large packaging facility. There's no harm in that. Let's just look at everything before we waste years and years of time to negate businesses, because people have been waiting since June to do this, and I want to be respectful of everyone's time, so I'll pass the mic on. But I also wanted to, if I can approach the bench, how do I?
Feel free. That's great. Thank you.
That's just a list of approved pesticides that can and will be found in the approved government not medical, but the approved retail cannabis that people will purchase. Myself, as a farmer, I go through an extensive process to not use pesticides. I have an integrated pest management system where I introduce live bugs. I don't want to smoke. I smoke pot. I don't smoke pesticide. But all the people that are going to go out and buy government weed, that's what you're buying. And I just want you to know that although it is government and although it is well regulated, it doesn't mean it's safe and it doesn't mean it's better. Because if you're buying a carrot, you go to the farmer's market. That's where you get the good shit. Right?
Thank you.
Hi, I just have a couple of things to say. I have a couple of questions.
Just a reminder to name
sorry.
and address.
I'm Rachel Rose. I have Ocean Valley Inc. on 3rd Avenue, 2974 3rd Avenue. It's a retail store, so I like what Joe had to say. You know, cannabis is just another retail thing, especially since we're not classifying it medical or, you know, recreational. It's just cannabis. And frankly, I've worked on the medical cannabis program through Health Canada. During the last 10 years when they had the program, I was a designated grower for a couple of patients, and it wasn't regulated. They don't check up on anything. They don't check up on anything whatsoever. We just did whatever we wanted to. The patient got their product. Great. You know, they gave us pesticides. They didn't care whether they were regulated or not. They were just like, here, this is the chemicals. Grow with this, spray with this, give it to our cancer patients. And frankly, the chemicals we were using cause cancer. So it's kind of gross. As for the retail thing, it is no different. So like, why couldn't a retail store that's already existing sell cannabis? You know, why do they need a specific license for that sort of thing? You know, we don't get specific license to carry, you know, collectibles or, you know, clothing or jewelry, you know. It just says retail and service on my business license. So why couldn't I sell cannabis in my location? That's my big question. And then the other one is like, why restrict how many cannabis retailers there are? You know, we don't say how many spas can be on the street. You know, there's at least, you know, 3 or 4 different people offering the same kind of services on the same location. You know, people have choices. They should be able to make the choices where they want to buy their cannabis. And as for like this whole like why can't you sell it in a health food store? You know, you should be able to buy fresh cannabis in the health food store and have it be deemed organic. There are places that test it. You know, when you did go to the dispensaries, there were dispensaries that were regulating it, self-regulating, and making sure that there weren't any pesticides or it wasn't being grown with chemicals. And for my clients, they were only wanting that sort of thing. And even still, people still call me about it. I haven't done it in years, but, you know, like, I don't see why we couldn't carry proper cannabis in our location. So that's what I wanted to say. Thanks, guys.
Thank you. Rebecca?
Mayor, Council, my name is Rebecca Standley. I own Full of Beans Play Cafe on Argyle Street. It is not just another product, and I've worked really hard for 2.5 years to change the image or be part of changing the image that Port Alberni generally seems to have around the uptown area. And I feel like not putting some kind of restrictions on the sale of cannabis would be really detrimental to a lot of the efforts that myself and other business owners in the area have made in the last several years. I have many parents that have flat out told me they will not bring their children to my Play Cafe because of where it is located. And I would really hate to see a cannabis store open up next door and have to fight yet another stigma or preconception about what's going on in the area. So as a business owner of a business that's frequented by young children and families, I would really encourage council to consider that setback is not just optics. It is optics, but it's optics that have an effect on where people go and where they're willing to take their children. And yeah, I would really hate to see there be a detrimental effect to my business or anybody else's business because we've got 20 cannabis stores in the uptown area and now nobody wants to bring their kids down to this part of town. Where I am, you know, I considered liquor stores in picking a business location. So I know that there isn't going to be able to be a liquor store open up next door to my business. And so yeah, I think it's important to keep those things in mind when making your considerations and your decisions. Thank you.
Thank you. Just over here on the side. Oh.
Sorry. I'm Jim Baxter. I live at, I don't know the address yet. It's at 5th and Marpole. And I was under a misapprehension that this was about drugs in general and the city dealing with it. And so I want to talk about drug addiction and things, and I'm not sure that that's appropriate at this point, but I will leave that up to you to decide instantly.
If you want to, I would just ask that you speak briefly if it's on that topic, because we do want to try to keep to retail sales as much as possible. So just try to be very brief, but we would welcome your input.
Okay, I just spent a year down in downtown East Side, Vancouver, researching drugs and addictions because I had heard a lot about it and became very angry at the regulations and laws that the federal government have. So I talked to everybody and anybody who was in the drug addiction business, either service providers or addicts. And I came up with a very simple brochure, which I can share with you later. Basically, we're talking about drug addiction, and it is not, very definitely not, a lifestyle choice. It is an illness. It can strike anybody. It affects thousands of people in every city. And the only difference between the people on the downtown east side and the people in Shaughnessy is that the people in Shaughnessy have not run out of money yet. The people in the downtown east side have. The cause of drug addiction, nobody knows. It's incredibly complex. There's still debate about whether it's a mental illness or a physiological illness. And there is absolutely no cure that we know of right now. We spend millions and zillions of dollars on rehab and detox and that sort of thing, and the people come out of those programs and immediately go back to their previous lifestyle. And the actual success rate of a big, well-funded program is less than 1% after 1 year. 99 out of 100 of the people will go back to their addictions. The programs that have worked in the world are very cheap and can be done easily, but not necessarily by the city of Port Alberni, because this involves a lot of regulation at the federal level. Prohibiting drugs doesn't work, as we know from the wonderful war on drugs. Prohibiting drugs results in increased addiction, increased crime, increased gang activity, increased violence, and no reduction in drug use whatsoever. There was a trial a few years ago in Vancouver called the Naomi Project, funded by the American Institute of Health, or whatever it was, where they provided heroin for a group of heroin addicts. And after, I believe, a year, they found that every indicator measured success. The use of the heroin decreased by each person because it just became a maintenance. There was less crime, there was less social call for social services and emergencies, that sort of thing. The health of everyone involved in the project improved, and some of them even got so clean as they actually went out and got jobs. So prohibition doesn't work. Reducing harm through drug regulation does, and that's basically what we're left with is that.
Thank you.
Thank you.
Sorry, you just had one speaker up here first.
Hello all, my name is Colin Baldwin. I live at 4388 Roger. I've been here for about a year. I wanted to discuss a little bit about how awesome retailing cannabis is and the idea behind it, and we want to get some information from us about that. I wanted to talk a little bit about the differences of the products. We have two primary models we're working with, that's tobacco and booze. And I wanted to kind of separate the two dangers in there. We've got our physical dangers and we've got our social fears. And our social fears are just as equally dangerous because it's our responses to each other that comes from that. Going to the physical dangers, I'll quickly go on booze. Booze, you can, I'll try and condense it. I'm not going to use too much science. I can down a bottle of booze and I can end up in the hospital. I can die. And it's most likely, in most cases, that's the situation I'm going to be in. Tobacco, well, we might be able to smoke it. You might get a little bit sick. Have you tried eating it? Okay, have we instilled the toxicity via tobacco? Okay, that's what I'm gunning for. So now we have cannabis. Now cannabis, and I'm going to relate the medical component just briefly with booze. The medical component of cannabis, it helps us neurophysically. It helps us with our mood. Booze you can use as an you can use to sterilize stuff. You can clean, you can kill parasites with booze. But it's still a heavy poison. When you consume it, you're going to be poisoned. And I think this is where the root of our fears are. When we physically hurt ourselves, we can throw ourselves back. Oh, wow, why did I drink that booze? I don't want to do it again. That was dumb. But when we look at it at a social point of view, we go, but we have our family who are going, oh, that's dangerous. Man, where's this guy going and whatnot? Because they're physically hurt and it's physically harming. Now, there's other things to go into on that. I won't go on to it, go science. I'm glad that it's become regulated so our scientists can properly bring papers to all of us and so that we can be on the same page. When it comes to retail, one of the other exciting, just to finish what I was talking about with relating them, if we're going to zone them like liquor stores or if we're going to zone them like tobacco, let's consider that harm, the visibility. You were talking about schools, of course, 300 meters. I think that's a great idea because subconsciously, if I'm going to school, I'm not seeing liquor, I'm not seeing booze, I'm not seeing cannabis, I'm not seeing all the things my parents don't want me to know about. I'm literally just having a childhood. And really, we owe our children that. You go have your childhood, but 300 meters away, we can at least buy whatever it is that we're going to go. So the excitement on retail cannabis is, well, it's good income. And I think it's a good idea both for liquor store or for government run and private. Because it's going to bring in a lot of tax revenue. And one of the exciting things about cannabis is cannabis cultures. Now, I know the title itself was taken by Mark Emery for his stores. Cheers, go guy. Cannabis culture is a real thing, though. And it's not just the cannabis that's going to be bringing in a lot of this income and that's going to be giving a lot of jobs. It's going to be a lot of the paraphernalia. We have musical artists and other such things that are out there that really are this culture. They're not promoting this culture, they just are this culture. And it's just a part of mankind, and it's in our social groups altogether. So I think it's exciting that we move forward with it. I think that we should have the more, the merrier. We have clearly come through alcohol prohibition, and we have studied it, and we know that it is just as nasty as it was the day it was born. But at least we stopped using rubbing alcohol to make it. So we are now at the opportunity to move forward with this. And I think if we can include all these wonderful things, including our cannabis culture, we will all win and we can all learn from it. So thank you for hearing my input.
Thank you. And I just want to remind everybody that in order for council to get as much value out of this as possible, because we are forming what direction we're going to move forward, we really want people to focus as much as possible on the things that we can control around this. So not whether or not, cannabis should be legalized. It is legalized, but how can the city best move forward? So we have control over things like location, how many are clustered together or not clustered together. If there's specific requirements we want the businesses to have for their licensing. An example of that is with our current business bylaw licensing for medical marijuana dispensaries, they had to have transparent storefronts, they had to have warning signs, they had to have video surveillance, things like that. So if you can focus your comments as much as possible around things that council can do, then that's going to give us the most value out of your input today. The front here.
This is speaking to cannabis culture, which in my neighborhood, I've spoken to Trevor when I came in, they have fabulous concerts, which unfortunately it's like a Greek amphitheater up Butte Street, and it's very, very disturbing. And if he wants to have his nice concerts, he needs to be in a building that protects us from the sound. And we've talked about that before. So that's all I have to say about that.
Thank you. And just your name and address before you leave.
Oh, Janice Sheehan, 4727 Butte.
Thank you.
Thanks.
Rebecca?
Yeah, Rebecca Terapowski. I work in the area of the overdose prevention site, and I live out in Beaver Creek. I mean, I can understand why people want their pot shops and everything, but I've been in around this town long enough to see that things that are coming in are not helping the crime, and nobody seems to be addressing these issues. This is a community that has fantastic families and wonderful young people, and it's a great town for activities of any type, beautiful surroundings, nature. We should be promoting health. I am in agreement that the pot is not the same thing as a piece of paper or a package that I would sell in my retail store. It is a narcotic of sorts. It has those properties. It should be in the category of tobacco and liquor. That's very obvious. Very obvious. It is absolutely harmful to young people. It can cause brain problems for the developing teenager. This is important. So when you're wanting your pot shops all over this valley, don't forget about your optic view near the high school, because those kids take the pot. If it's available, they will take it. And this is not good for the developing young person. So I just see there's so many issues on this. And when I hear the report from the development officer, they just have their models. They want to put them all in there. And nobody's thinking about the lady up on Redford who's got the noise happening, and that's the very least of problems that are happening around there. So let's add some more problems. If you want your marijuana shops in town, you better make sure you've got regulations established. The federal government obviously hasn't provided any infrastructure or model for dealing with it. There was some mention of a first response team. I don't know what the heck that is. Is that the police or what? And who's going to regulate these pot shops? And what about if the fentanyls get into the pot that's going out on the streets?
Just want to ask everybody to please be respectful. We don't want to have any cheering or booing or anything like that, because we want everybody to be comfortable giving their opinions. Thank you.
No, isn't there this big crisis going on out there? And it's moving, it's getting worse, so it can move anywhere, right? Police told me it pops up anywhere. So,
well, I've had drugs put in my drinks before too. If you don't have the floor, you need
And we're not going to allow people to speak. We want to give the person at the mic her opportunity to speak.
I was actually trying to support.
Sure. Thank you.
yeah, I mean, I'm really behind the businesses who are suffering already, who are pure retail, and they already are dealing with issues with drugs, like the ones near the overdose site right now. They're having terrible issues already with stuff related to drugs. So I personally, the less is the better. Make them accessible for those who want them, but make sure it's regulated. And I'm not for having them all over Hell's Half Acre. And you must ask the people in the neighborhood, because what about democracy? City Hall can't just come up with a model and go, okay, this is great because it's less paperwork for us. You know what? You have to consider not just the people in this room, but how many people are in this town and how many people have voiced their concerns to me. You know, they're not being heard. Maybe you should get a written referendum and ask people what they think. Because I'm not really speaking for myself, because I don't care if you smoke pot. You know what? But I hear this all the time from my friends, people that I work with. I'm speaking for these people, and a lot of people are afraid to speak up. So yeah, it sounds great to have pot, and I have allergies to it, so I have no protection if I'm going to some place and there's a bunch of pot smokers. The police have told me, well, we can't do anything. It's just like the smell coming out of the pulp mill. You know, some people are highly allergic to it, so I have no protection. It took the government so long to get smoking off out of the public. Now we got marijuana shit smell coming up, and it smells like shit, skunks. It stinks. It does smell, and some people cannot tolerate it, so there's no consideration. I don't hear any consideration for people who are allergic, and you don't want children near that anywhere. Not to mention, if everyone gets too cozy rolling up their little joints or whatever they're doing, their little kids and their children are going to learn by modeling. They're going to watch this and say, wow, it's great. We have 10 of these shops in our town. Mommy and daddy do it all the time. Like, these are my concerns. So I am really with the ones who are wanting to approach it very cautiously and listen to more people. It is not a retail product in the same category as a book or a jacket. It is a narcotic substance. It can affect danger. What about that man on CBC lost his teenage son with 3 or 4 other teenagers in a car, directly related to cannabis. You know what? That was a young boy with a whole future. That happened back east. I'm sure it wasn't the first one. So don't be too happy to just go and do this because you're going to get more taxes in your coffers. You know, you got to really think about outside of yourself, about the young people, and about, we already have problems on our highways. We already have a drug problem in this town. It doesn't seem to be going away at all. It's getting worse. Just talk to the police. And there you have it. That's what I want to say. I hope you consider it. I'm really for the young people, for the businesses, and for people who haven't got a voice and things are going to get, decided and they haven't had any say in it. So let's think about democracy and the youth and the health of our youth and our young people.
Thank you. I have the person on the end in the striped shirt first.
Hi, good evening. My name is Anthony Biario. My address is 981 Beach Drive. The most important thing to keep in mind here is that we're talking about establishing retail shops, and there's a great deal of education that can and probably should happen throughout the community. About 6 years ago or so, I came across a kiosk, if you will, for Sensible BC, and at that particular point, I decided that it was my responsibility to my own children to do some research on my own, to see what the cause and effects, chase the rabbit holes, do those sorts of things there. The federal government, as well as the BC legislature, have put together some very strict guidelines for each proposed type of business associated with this program of cannabis. From the standpoint of a retail store, all of the products that are in the retail store are prepackaged and sealed. There is not an odor situation associated with the majority of the product. Are there sample jars? Yes. Customers aren't allowed to touch them. They can smell them, they can't hold them. There's a bunch of different things like that are in place to assist the owner of a shop as well as the customers coming in to make sure that when a product is being delivered to a customer, they're getting what they're looking for. There are absolutely no opportunities in the sense of giving medical advice, where nobody's looking to be doing that, and you can't. The 300-meter separation between different shops would provide that, and some of the terms that have been talked about this evening can be taken and misconstrued several different ways. When you're looking at storefront, pardon me, when you're talking about having an overpopulace of storefronts, storefronts on one particular street or something of that nature, it can allude to all kinds of different things. But ultimately, you want those kind of dispersed a little bit, and 300 meters gives you that space to you know, so that you don't have a Starbucks on every corner, because that kind of dilutes the situation. The people that are looking to open proper establishments, regardless of what they are, they're entrepreneurs, they're people that are looking to represent a culture, a product within your community in a socially responsible way. And I think it's important to realize that if you have people that are coming forward applying for licenses, they're automatically telling you, listen, whether my activities in the past were illegal or not, I want to be part of this community. I want to be paying my taxes. I want to be a member of the community. And I think there's value in that. We're all people. We're all trying to raise families. We're all trying to be socially responsible. And I think we owe it to ourselves, to each one of us, that if you have questions about something, go to the government's website. Go to those places. They're there to represent what Canada as a country has said, this is what we're going to allow and this is what we're going to stand for. And these are the regulations that we must pertain ourselves with. I thank you for your time. I appreciate it. And thank you.
Thank you. And the next speaker, just, yeah.
Good afternoon. My name is Christine Jarvis, 4754 Elizabeth Street. I'm also the general manager and partial owner of the Port Alberni Cannabis Club. And I wanted to maybe make comments about a few things that have actually come at you guys already. Number one, I'm a pothead. I'm a user. As of a year ago, maybe a year and a half ago, I started heavily using. I'm down almost 70 pounds. I have no anxiety. I have a job outside of my home, and I can raise my kid happy and healthy. And I am what most of the people who smoke pot are doing with their lives. Now, VHA set out a press release approximately 5 years ago to most of the doctors on Vancouver Island to not recommend, to not give out prescriptions. So the basis of our clientele has to do with a lot of medical users that were never able to get their prescriptions. And a lot of them are aged users. They're 50 plus. And I mean, I'm not trying to say anybody's old. 50 plus that come in and they are trying to recover from an injury, even from a different illness or sleeping. And they have noticed, just from their experience, the difference between different prescribed drugs from your doctor and cannabis. And I'm going to start off with my little write-up, just so I can keep going in a proper flow. The Port Alberni Cannabis Club began way back in 2015 when Trevor Bertrand actually stood in the City Council chambers and spoke against the proposed medical bylaw. He didn't want anybody to bylaw it. He thought we should actually wait until the day to come out. We felt that there was going to be too many discrepancies when the federal government finally rolled out their concept of legalization. Well, here we are 3 years later in the midst of legalization, and the Cannabis Club holds a municipal medical cannabis business license. With this license, we've been able to help thousands of clients while building one of the first cannabis retail outlets that employs 7 people. 7 households rely on our business to sustain their homes. So here's some of the information that we believe you guys need to move on with some of your decisions that you're going to be making over the next little while. Our clientele consists of all age ranges, races. There's no specific pothead categories, so it seems in some of our culture and social stigma. So in 2012, most of these stats do come from Stats Canada. In 2012, the people 15 and up that admitted using cannabis in BC is 54.6% in males and 38% in females. And the breakdown of age ranges from 25 to 44, 55.9% of people admitted to using cannabis in 2012. Between 45 and 64 years old, 55.2%. 65 and up, 17.2% of our aged population has admitted to using cannabis in 2012. And I can guarantee you those numbers have probably gone up. The other reason why I think those numbers would be going up is the social stigma isn't there as much anymore because it is legalized. We have more people coming into our store saying, wow, you guys are legal now? We can actually have this stuff on hand and use it. They've been waiting decades for it. So a little more recent of a study was done. On December 18th, 2017, Statistics Canada published the first experimental volume estimates of cannabis consumption in Canada from 1962 to 2015, along with corresponding estimates for the number of consumers. According to these new estimates, Canadians' overall consumption of cannabis totaled 694 tons. That equates to 318 grams per person. For every single 35 million people, they would consume 318 grams a year, and that's average. The reason I mention the ages and specifics is, again, because of our clientele. You need to know that it's not just young users out there. It's not the teenagers coming in. We do every once in a while have somebody come in that's younger and we ID them. And of course, there's no way, because we believe that anybody under the age of, my personal opinion, under the ages of 25 should never consume, because your prefrontal cortex has not been developed properly. So along with the pain and sleep and anxieties, other studies that have been done and that are being done as we speak is about cannabis use in the opioid crisis. There's a few key points that I found on this fantastic PowerPoint presentation. It's called "Is Cannabis Part of the Solution to the Opioid Epidemic?" And it was created by Dr. Dustin Salak, a doctor who runs 2 outpatient clinics in Maine and started treating his patients with cannabis to wear them off the opioid painkillers. Now, I'll just give you a few of these stats. There's a lot out there. You can do your research as well. Some of this comes from CDC. 44 people in the United States die every day from prescription painkiller overdose. Almost 7,000 people are treated in emergency departments every day for using prescription opioids in a manner other than is directed. Sales of opioids quadrupled between 1999 and 2010. Now, the reason why I bring up the opioid crisis is because cannabis has been and can be used to help people either maintain and not increase their use of opioids or get off of them completely by either increasing their appetite, by reducing nausea. It helps. It's just another tool in our toolbox. So, let's see. Now, the Port Alberni Cannabis Club is right downtown in that neighborhood. We're right where the opioid crisis is happening. We're right by the safe injection site. We're also by the sobering house as well. I believe that we can help the neighborhood. I believe the neighborhood can be safer with us being there. We have an owner that is extremely passionate, and I apologize for the loud music as well. We did have that talk. He tries to keep the neighborhood safe. I mean, we have a girl that works for our cannabis club who's very young, very pretty, and she feels safe going outside at 7 o'clock at night in the dark to have a cigarette where we are because of how our club has been treating the neighborhood. When we do hold our fundraisers, our hip hop concerts, they may be loud, but they're usually local fundraisers that end up being for the Zat Zoo project. So we try and help out the community as well. The other thing I'd like to add about parents and children, that's another one that was brought up. I have a 10-year-old son. He knows I use cannabis, and he also knows I'm the general manager of the Port Alberni Cannabis Club. He knows what it looks like, and he also knows the stats behind it. He knows there should be no way he should ever go near it, and he should never touch it. It goes again to parents and properly educating our children, just like you would with alcohol, or you would with cocaine, or you would with heroin. You'd lock it up, you'd keep it away, and you'd keep them educated. I don't think this being legalized is going to make a difference when children are involved.
Thank you. Before we go to, I'm not going to let anybody who has already spoken speak again until we get to all the other people who haven't spoken yet. The gentleman in the black shirt.
Good afternoon. My name is Bill Young. I have a concern about the production of cannabis regarding the licensing of home-based production business. And about 6 months ago, I guess, a business moved into our neighborhood at 6th and Mara Street. And I first went through the bylaw department, talked to several people, and I've kind of gone on this full circle to try to smooth out what's happened in my neighborhood. People have moved in, and they have not adhered to the bylaws, which say that if you run a home business, you have to run the business within your home. You can't build outbuildings to promote that business. And so what happened with my neighborhood is that I got a couple of pictures here. They've just ruined a good residential neighborhood with that sort of mess. And I haven't been able to get anybody at the city to do anything about this problem. And I've run out of options, so I came to the meeting today, and what they put here, this outbuilding where they're growing cannabis, is illegal as far as the home-based business bylaws are concerned.
I just want to remind you that we are looking for input on retail cannabis, and we're not going to be allowing retail cannabis sales in residential neighborhoods.
Right, but I'm talking about production here.
Well, we're not talking about production during this meeting. So we did receive your letter, and we thank you for that. But we want to try to keep comments as much as possible so that we can let everybody speak who wants to speak to retail and what regulations you see we should be considering for retail cannabis. So I'm hearing that you don't want it in residential neighborhoods.
So when would you suggest that I can speak further about the production in residential neighborhoods?
You could come and speak at any regular council meeting. And
So-
our next one, I believe, is November 28th.
You'll notice that I was on the agenda for this meeting, but basically what you've done is shut it down the same as they've been shutting it down for 6 months, instead of putting your foot down on this operation.
Yeah, so it's just not the topic of tonight's meeting. We are trying to discuss retail cannabis.
Yeah.
So I'm going to ask all of the speakers going forward to keep their comments to retail cannabis and what they would like the city to do. So again, the areas that we have the ability to control over retail cannabis are location and business licensing requirements. So we are not looking for opinions on whether or not retail or cannabis should be legalized. We're trying to keep it to that so that we can gain as much input from the public as possible tonight. So we have received your letter, and if you want to come and speak to council about it again, I think the best time would be at our next council meeting.
So would you send me an invitation?
Sure.
Thank you.
Thank you.
Mayor and council, staff, my name is Amanda, and I live in the beautiful harbor city of Nanaimo. I live at 98 5th Street. As you guys may know, we have a culture also known as Nansterdam. At the peak, we had 32 dispensaries operating in the gray legal industry. Nanaimo Council went a different way. They decided to implement a wait-and-see approach just to see what the grassroots level will accept. And In December of last year, activists approached council and asked them to establish a task force. And in that task force, they got to discuss everything cannabis related and what's going to happen in the next 5 years. And so for this first year, we are literally limited to just bud and retail sales. But in the next coming years, in your council term, you're going to have to deal with extracts. You're going to have to deal with microcultivator licenses. Anyway, so our task force, we decided to implement as like a recommendation of a site-specific use only. Unlike liquor retail stores, all proposed CRS operators will be required to submit a rezoning application to permit the use on a property. And by adding the definition of a cannabis retail store to the zoning bylaw and not adding it as a permitted use within any zone, the bylaw will only permit a CRS as a site-specific use through rezoning. The bylaw will also amend to clarify that cannabis and liquor sales are separate use from retail by amending the definition of retail stores as follows. That's what it says. Retail store means a store in which any type of goods or wares are sold or rented to the final customer, provided that the product may be stored or sold from within a building. This definition specifically includes personal service use and pharmacy, but excludes cannabis retail store and liquor stores. So we, come October 17th, we had 27 dispensaries, and a majority of them closed so that they could become in compliance as a retail recreational store. The stores that are now open are still working under Judge Fellon's ruling from the Allard trials, which is, he basically said medical cannabis access is through dispensaries. And so all the dispensaries that are staying open and they have medical patients, they are still working on that citation of that trial. So Allard and all. And also, I would also recommend that your council establish a task force. It is very, very important. That way you could bring in police, you could bring in the dispensary operators, you could bring in VIHA, you could bring in the license producers, you could bring in a whole schwack of people. And then also, final thing that I would like to talk about is distance between schoolings. Right now, there's a case test happening by a lawyer. His name is Robert Laurie. He was on our task force. He's suing the city of Vancouver for supporting 52 unlicensed shops because they fall in between the 150-meter rule or the 300-meter rule, the 2-block radius from a school or a daycare, because they're medical cannabis patients. Municipalities have no jurisdiction on telling a Health Canada CDSA exempted patient to walk 2 blocks. If you have cancer and you're terminally ill, and you have AIDS or whatever, and you need your cannabis oil, you guys can't tell them to go 2 more blocks. And so that should be put in as a you should watch it, because they actually very much might win. So yeah, just to clarify, Nanaimo has decided to go through the site-specific use only. So the first definition that was being asked for, establishing a task force, and that case test. So
Thank you very much.
Thank you.
Right here. Yeah.
All right, this is definitely going to be retail related. My name is Dave Mills. I live at 656 Albert Street in Nanaimo, but I'm here regarding Pacific Rim Shopping Center here in Port Alberni at 355 Johnston Road. We have an application in for BC Cannabis at site at that shopping center. The company I work for, Northwest Properties, we actually opened the first one in BC in Kamloops, so I can speak to the effect that it had. There's no, as far as retail goes, it drove a hell of a lot of traffic and continues to today. It's been 5-6 weeks since it's been open. There has been 0 incidents with security, and everybody would be very surprised at the clientele that's going into this place. It's not seedy or anything untowards. It's more like a wine shop. Somebody mentioned they look like Apple stores or Mac stores, and that's what they look like. So from my experience, from the one we've already opened, nothing but positive. We are currently opening one in Country Club Centre in Nanaimo, BC Cannabis, another one at Discovery Harbour Shopping Centre in Campbell River, and we're working on one in Duncan as well, and one here all with BC Cannabis, and it's just been a really good relationship with setting that up. I do live in Nanaimo, speaking to all the dispensaries that were in Nanaimo. I live in the Old City Quarter area, and there's a lot of them around, and I have to say that I've seen a serious decrease in cannabis-related activity on the streets. You used to be able to walk through downtown and you get the weed, people asking you want something. That's just gone. So I would argue that the kids walking down the street, that option is being removed. It's already coming out. The retail is providing access for the people who need access, and it's removing the people on the street. Not everybody, it's never going to do that. But so my experience with the retail side of things is that it's been nothing but positive. And I don't think there's anything to be worried about on that. Now, of course, I understand everybody has their own social issues for neighborhoods, and that's not what I'm here for. But in general, there's been nothing but positive. There's been no negative reactions from the community, the people shopping in the place, incidents in the parking lot. Nobody buys it and goes in their cars just puffing up with smoke in the same way people don't go buy a Mickey of vodka, some may, and go start drinking right in the parking lot in front of the liquor store. It doesn't happen. It hasn't been an incident, so I just want to put my 2 cents towards that. So, thanks.
Thank you. And Sean.
Madam Mayor, Council, ladies and gentlemen, my name is Sean. I own Full of Beans Play Cafe. My wife's the boss. I wash the dishes. But I just want to put, for me, far as the retail aspect of this meeting, the idea of having your market share totally condensed doesn't make sense from an economic development standpoint. Pat can correct me if I'm wrong. The one thing, though, that following the guidelines of alcohol, for me, makes sense. It is not tobacco, respectfully. I spent years in the medical field as a critical care nurse, and I've seen the effects of all different types of drugs. It's a drug, simple. Now people say so is caffeine. Caffeine doesn't make you high. I went through as a military officer, retired, I went through the government system. It just didn't work for me. So for those who it works for, I am glad that you find something that gives you the relief that you need. For me, it didn't. Right? Didn't put me to sleep, didn't get rid of nightmares, made me stoned. That's not the point. So for me, it just wasn't what was designed to do. So by putting in some sort of restriction with regards to how close they can be, like what you had previously before the new laws came into effect, to me makes sense. The one question I did have, if I understand the presentation that was given earlier, that we are starting from scratch, so that the whole medical marijuana is no longer in effect here in the valley. So those licenses are null and void, if I understand that presentation. Is that true?
I'll give our bylaw manager, bylaw or CAO an
Madam Mayor,
opportunity.
maybe best to have Sean finish his
my thing is that
comments, and then the manager bylaw.
if indeed that the differentiation between recreational cannabis and medical cannabis, of course there's lots of misinformation out there, and so for me, I don't care if you're selling popsicle sticks or cannabis. I just would like a universal application of the rule. I sell coffee, you sell pot. Good for you. Let's just make sure we're treated equally. I can't operate without a business license, so therefore I hope nobody else can either. And that's just my 2 cents as a business owner. With the stigma, it doesn't bother me. You know, people think Port Alberni is dingy. You guys don't have a clue. It's not. It's just a great little town. It's not dangerous. So with regards to the cannabis, though, yeah, I would definitely like to see you follow the lead of the BC Liquor. That would be because the restrictions are in place, and it's there for the public. And it does put the onus, I'm sure, on the responsible business owners to ID individuals and run a responsible business. So in no way is it an attack on those who operate these businesses or for those who enjoy smoking cannabis or eating it or whatever. That is not what this is about. It's illegal. So let's try and come up with a positive solution. That's all I got.
Thank you. And if Manager Abila just wants to provide some information on what happens with our current licenses, that would be great.
Thank you, Madam Mayor. Our current licenses, we amended our bylaws and allowed medical marijuana dispensaries. As it's been previously stated, it's an illegal business in the eyes of the provincial and federal government. However, in 2018, they did pay for and obtain legal licenses from the City of Port Alberni. So it's the intention of city staff to honor those licenses until December 31st, and in which case those will lapse. And the idea is with new retail cannabis business provisions coming into the bylaws, we can repeal medical marijuana dispensaries and the definitions associated, in which case, like I said, those licenses will lapse and they'll no longer be renewed for the 2019 year. I just want to make one more comment that I didn't mention earlier, if I may. There is a strict process that, like I mentioned, the province will have for the application process that somebody needs to follow. And there is a timeline set. We want to move forward with these regulations. I just want to bring it to the attention of council and the community that each application received will come to the local government, and there has only been one received by the city from the province. So while we do want to get these provisions underway, we do want to do it correctly and have all the input. But it is relevant to note that to date, while there might be many applications going to the province has only commented and come back and asked for recommendations on one. So there is only one that we're kind of holding up right now in this process. Thank you.
Thank you. And we'll take more speakers, but I just want to remind the public whenever possible to speak to council and not to staff or the other members of the public. We don't want people to be debating our staff who are here to provide information for us or other people in the public. And CAO.
Thank you, Madam Mayor. I just want to make a point of clarification that staff recommend that the city not interfere with the existing medical marijuana licenses for the remainder of 2018. Those licenses were taken out with good intent by the license holders and by the city. And we recommend that council direct that they not be renewed in the new year. So in anticipation of your decision, we are not moving to accept renewals of those licenses, but that is completely a council decision, and staff will take council's direction on that. So just to be clear, we're recommending that, and we're awaiting council's direction on how we proceed with those licenses.
Thank you. And back here. Yeah.
Hi, my name is Kevin Haslam. I live at 4888 Josephine Street. I'm here. I know you're here to talk about the retail sales, and I want to stay on that topic. A lot of what I'm hearing, though, is it's being compared to tobacco and alcohol, and it's not either one of those products. It's a completely different thing. The whole purpose of to have access is so that there's a reason why it's called medical marijuana. It's helping people. People need access to it. So if you're restricting it by distances, you're restricting people who have medical challenges to get it. You can't call it alcohol. It's not. Alcohol kills people every day. So does tobacco. There's never been a documented case of marijuana consumption killing anybody. So when council's keeping that in mind, I get you don't want 5 in a row, but you don't need a 1,000-meter barrier either. That doesn't allow people access to it. The whole purpose of selling retail sales is to make it accessible to the public. Thanks.
Thank you. Yeah.
Mayor and Council, thank you. My name is Aloma Brailsford, and I'm from 6225 Lucrin Road. I have my aunt is in her 80s. She has half a kidney, or has lost one kidney and just barely hanging on with the other one. And I take her to get her medicinal marijuana. Now, I came up here on 3rd. We were going to the Wee Medical because that was the best one for her information. She could see what she needed and buy it from there. I was in another store in town on Johnson, and they are very beautiful store, but it's a lot of money for the show. It's not just medicine. I went in there because when this the wee medical on 3rd was closed, I didn't know where to take her. So I went down there, and I don't know, they had some, I don't know, brittle, I don't know what it was, but it wasn't what I was looking for her, and there was none that you could see. Now, so I don't know, I guess I have to look on the street to help my aunt. I don't want to do that. I'm afraid I'm too old to go knocking on this, or hanging around a corner and saying, "Have you got any Miami's?" No, I don't want to do that. And she wouldn't want me to. But now the other thing, she's on, like the people on disability, and as well as her in her age, it's hard for these people to afford this stuff. I mean, it's expensive. We thought when the government took over, we'd be putting the back guys in the box and saying goodbye, but hey, it's so expensive. We might as well keep looking for the whatever you call that guy that doesn't have a business. He's selling it out of his house or wherever, because those you can afford. Because of course they're going to cut it down because they know everybody's prices are up there. So hey, we know how to get you back. That's unfortunate because that's not what we want marijuana for. I know that people enjoy it, and that's fine. You know, stay home, get happy, and have a snack. Good for you. But my aunt, she was using a cream as well, and I asked the people on Johnson, do you have any cream? Because she's been putting it on her arthritis or rheumatoid, whatever it is she's got. And they pulled out a little bitty, $90. Come on. What are we doing for the old people or the people on disability? People on disability are only making, if they can survive on $900, if they're even getting that a month, they're only allowed $355 for the rent. What are they going to live in? How are they going to eat? Do they stay on the street so they can afford it? What do they do? Anyways, that's the position that the people are being put in, and I'm worried for my aunt. It's just not right. Thank you for your time.
Thank you. In the back.
Madam Mayor, Council, ladies and gentlemen. My name's Al Frank. My wife and I own West Coast Hemp down on 3rd Avenue, 3473. We actually live out Beaver Creek, so we don't have some of the aromas that some of the others have commented on. My plight, I guess, is I heard a lady talk about 4.5 years working on a license. We've been almost 8 years doing the same thing, working with City Council, being told, yes, hang in there, work along, you'll get there. We're still waiting. So back in 2010, we scouted out and purchased a building next to the Dairy Queen. And we approached City Hall, told them what our future plans were, and they said, great, go for it. So we did. Throughout the plight, others came into town, not from Port Alberni, but were from out of town. They ended up with the license ahead of us. We don't understand why. We just know we've been kind of excluded. So I could go on and on about the 1,000-meter rules, all those things that have kind of worked against us. What I am happy to hear is that with the new process in, there's hope for us. I like the idea of perhaps starting over. I think that's good to go. I also like to hear that we're open to change finally. it has been a long road for a lot of us. We are there. We're working to get our provincial license as well. We have similar stories to elderly people trying to get product. We feel for them. We can't provide it, but we'd certainly like to be able to. So the long and short, I guess we're really hoping that, you know, new people in both council and City Hall staff and the council, that they'll choose to do what's right and give us a license to dispense recreational cannabis so we can continue to serve the people of Port Alberni in a friendly, helpful, and safe environment. From what I am hearing, a lot of people are looking for that. We've had many stories of people that are, like yourself, out on the corner looking for stuff now because they can't find it. And it's really a tough situation to see. So hopefully we'll still work with you. We look forward to a future success for everybody. And hopefully our family business can continue to go forward. Thank you.
Thank you very much. Pam?
Thank you very much, Madam Mayor. It's Pam Craig. I chair the Board of Education for School District 70. I have a copy of the letter here for each councillor. And we are very concerned for our students in SD 70. We work very hard and educate them to the best that we can in regards to the dangers around use of drugs and alcohol and all those kinds of things. We have excellent policies in place, and of course most of our students are under 19, so any use of those kinds of substances are illegal. But we do have a concern about now with the new law that there is an increased exposure for young people to cannabis. And we would hope that during your deliberations that you'll find a way to make sure that does not put cannabis areas close to where students are. Now, of course, our schools are fixed places, so we can't move schools, but we do have a number of bus routes in the community where students will congregate in the morning and after school when they're returned by the bus. So I ask and urge council to consider that when you are making your decisions. Of course, all our staff are available to your staff for technical information in regards to those kinds of things. Superintendent Greg Smith, of course, and of course our operations manager, Greg Rowe, is most available to any member of your staff to get those kinds of pieces of information. And when I give you the letter, you'll see the comments made by Dr. Hasselback, who has worked or is the medical officer for Vancouver Island. And one quote that was in his report when he spoke to us was, the unprecedented change in access to cannabis in our community comes with some expected negative consequences that are specific to youth and to young adults, with potential for lifetime consequences. Furthermore, Dr. Hasselback spoke to the specific question of citing cannabis retail in relation to areas where youth congregate. So I urge council to consider those areas when you make these decisions. It is extremely important for our community, our young people, and of course, as trustees, we consider the young people we work with as our most valuable citizens. So when you're making those decisions, please consider that. And again, trustees are available to everyone from the council if you have any questions, and our staff is available for consultation. So I urge you to take advantage of that. Thank you very much.
Thank you. Anybody else wishing to speak? First time? No, sorry, Rebecca. Sam.
Hi, my name is Sam Brownlee. I live at 4205 Bird Street in Port Alberni. I have two quick comments. First of all, I think that in light of what my husband said earlier, and everybody laughed, well, some people didn't, but when he was talking about creating an area in the city specifically for cannabis outlets, the thing that he forgot to say, and the thing that convinced me that he had a point, was enforcement. If you locate the stores in one central spot, then the issue of enforcement by the RCMP becomes very easy. The issue of parking control, for example, you could put it in a spot where you have parking lots at both ends and make it a walking area. So now suddenly you don't have to worry about people getting stoned and getting into their cars, because enforcement becomes a very easy thing. The other issue that I'd like to talk to you about, and I know that there's been talk about sealed containers and so on, but I know that right now, if you drive up 3rd Avenue, there are areas where the smell of skunkweed would literally knock you over. So if places are going to be continuing like that to have marijuana used on site, then they need to be required to put in proper air scrubbers, because nobody should be subjected to that smell. I mean, I feel sorry for the people working in Van Nagels, because you walk in the store and you nearly fall over. So those are my 2 points, and that's all, and thank you very much.
Thank you, Sam. And we had a woman in the 3rd row.
Hi, Jenny Michelenko, 3703 Maitland, Port Alberni. I just wanted to make a point about, there's so many liquor stores in town, and I don't know why, now that we have a legal substance in cannabis, why it couldn't be matched with the marijuana stores. It's now legal, and I think it would be really important to allow stores to open, to create quality within the stores, the cannabis stores, retail stores that are opening. The ones that aren't providing quality product are going to be shut down. It won't take long before people realize that it's not a good product, it's no good, and they're going to not go there, and those people won't last. And pretty soon you could end up with 8 or 9, maybe 6 stores that are good quality products. As a person that does purchase for my husband for the medical reasons, and the reason we have never purchased from the government medical is because of affordability. It's far too expensive to order it through there. And now I realize that the quality also through the government is no good either. I go to our dispensaries, or whatever you want to call them here. I have been so lucky with the people that are running those stores, because they have actually studied into my husband's illness. They've looked into it, many of these people, to find out how they could, what would help, what product would help him better. And just to give you an idea, my husband has Lyme disease, and it's an extremely difficult disease to have. So to find what can control the pain, because our medical system is no help with Lyme disease, and I will tell everybody that right now. So to find the quality, he has been so fortunate with our dispensaries here in town that they have really helped us, and they always give a discount to help him. They know I'm there regularly to get the product for him. So I hope that gives just another little side thought for everybody when you're making your decisions about the retail side. Thanks.
Thank you. Is anybody else wanting to speak who hasn't spoken yet? Come on up.
Madam Mayor, City Council, I put an application in for cannabis.
Sorry, name and address.
Oh, Major Rye, 3908 Redford Street. I'd put an application in for a cannabis retail store and was approved depending on municipal approval by the provincial government. I just wanted to give you this.
Thank you.
I've listened to everything everyone has said. As far as I see it, the bylaw should be enforced as in C4, 1,000 meter separation. It is now a legal substance, but it is still a business. It's equal to opening like a muffin shop or cookie store or something like that. It takes a lot of investment and it's minimal return. Now it's legal to grow 4 plants at home, right? So why would you necessarily need to go and buy it, right? and the government is taxing 15% prior on wholesale. So the retail market is minimal margins, absolutely minimal, right? As far as accessibility goes, I believe, Councillor Paulson had mentioned, Port Alberni does have a bad stigma of having the most liquor stores per capita. I think, limiting the number of stores and the locations is very important. I also think you should delegate the bylaw officer for making temporary approvals until the actual city council bylaws are enforced or made, because the approval of the application is just temporary. All it does is forward it back to the province saying the city has acknowledged that it has received the application. It's going to have to be forwarded back to the province, at which time they will do a security check, a background check on me, and a financial integrity check. This is beyond the application process I've already completed, which has required a full business plan, financial, all my financial information for the past 5 years, and site information. So after that, after city approval, they're going to take it back and they're going to do a full security check on me. They're going to see the source of fundings, and I have to provide source of fundings for operating the business for 2 years, including inventory and employees. So this is not something that anybody can just apply for or just open a business. It takes $7,500 just for the application. So if you think people are going to be showing up with applications all day long, or it's not happening, they can try. If you pass with the application process, getting security or financial integrity checks will be another step, which is where the point I am. And if you delegate the bylaw officer to proceed with that, the city will get the application back from the province if they pass me, and at that point we'll have the final say on approving the license. So is there any questions that you wanted to ask? Or
Questions from council? No. Thank you very much for that information.
Oh, yeah, thank you.
Thank you. Anybody else wanting to speak for a first time? We are through everybody. Okay, if there's anybody who wants to speak for a second time, we will allow a couple more speakers, and then we're going to wrap up. And we are going to we want people to be brief, so just try to keep your comments as concise as possible.
Okay, I'm glad that last fellow mentioned that you can grow 4 plants in your home, and that would solve the lady with the ant problem. Grow it in your house, then you have not to worry about costs. I wonder why there are not people from Nanaimo here trying to promote pot in our town. I don't get it. And you say it's all wonderful, but I've heard stories about Hell's Angels having some little input into the industry here in town. I also have questions about what this response unit is. They talk about a response unit the same way that the overdose site does, our community response. It's just some little thing, like the police don't really get involved that much. Are these just like political buzzwords? I mean, what do they really mean? Also, who is going to regulate the quality of the product coming out of these retail places? Are there regulations? Who's regulating that? I mean, that's really important. I'm glad to hear that the Beans Cafe doesn't want it near them. They've got good reason. Personally, I'm for the fewer the better. I'm not totally against it, but more regulation, less, and why don't we think about a 3-kilometer distance from schools? Like, why do we want it immersed with our kids? Like, when I work, I smell the shit coming out of that grow-op in the old Stephen sheet metal. That's enough to knock anyone over. Like, nobody regulated that. So it's already out there, so why are we allowing more of it, right? I think, try and isolate it, more regulate it, easier for if there's any illegal stuff. I think if you let it go all over the place, you're just making a statement that, I don't agree with. Anyways, that's my say.
Thank you very much. Any final speaker? Aaron.
Do you hear what I hear? I heard a lot of questions, comments, and concerns about quality because of that pesticide list, because of a lot of the issues. Unfortunately, I'm going to speak to council. Any members of council, and the public who has questions around who is going to regulate this, who is going to deal with the quality coming out of these things. Very, very highly regulated, pardon the pun. It is very much up to the government to do so. Everything is screened, packaged, and produced properly, tested for mold. You can't even start a facility to produce without first producing 2 crops that are lab tested and come back showing, yes, you can produce clean product. Soon you're going to license a bunch of dispensaries with some junk product, and then the people will complain even farther, driving the black market even farther because it's cheaper on the streets, the whole rest of it. I grow pot. I have a medical permit. Do I want to jump through all these hoops to become legal? Yes. Do you have the ability to become my gatekeeper and change my mind? Yes. At the end of this day, I'm a criminal or I'm an entrepreneur. Very possibly both. But at the end of the day, it is you 6, who are the gatekeeper, 7. You guys have to decide about the production facilities in due time. But the quality concerns that come around that come from the legal shops. The legal shops that you're now receiving application for, you're now actually in the position to approve these facilities. Facilities which are not currently open to myself or anyone else. Amending the bylaws to simply change from medical sales to retail sales outlets, in fact, doesn't ever open the application to the public shy of one spot that's currently across the street from a daycare. We've bantered this back and forth. You guys can go ahead and approve them, but approving these facilities for the applications you get now and just enforcing that 1,000-meter rule will really mean that that process was done on a first come, first served basis, never open to the public, and it was done 2 years ago. That wasn't really kind of how it's supposed to be. I see a couple people in here that are actually just real good business guys. They're looking to now get into this too. But they can't if you just transition and make the ones that you already have legal, who are pretty flagrantly disregarding the laws, in my opinion. Anybody that sells pot knows what's going on. Let's not beat around the bush and say, oh, I didn't know. Don't give me that shit. We all know. I was one of them, okay? Now, I stood up. I tried to do your guys' job. None of you will try and do mine, right? So I'm trying very respectful to be understanding of your position. I would like you guys to be respectful and understanding my business also, and how it is very much depending on your time as council and how long the approval process takes. Someone mentioned how expensive and timely this is to get done. You're talking like an 18-month application for production facility, 3 months for a dispensary. So even if council decided today, hey, Mr. Joe, what do you think about production and all the rest of it? Let's just go ahead with approved use. You won't see anything from me or any of my guys for 2 years. The government is going to struggle with a quality product, quality, the whole bit. With respect to retail, you're probably going to want to put in some zoning for sure. Even if it would suck to say, yeah, okay, do them, anybody can do them side by side, and the government will kind of sort it out. They probably will. They probably won't approve buildings next to buildings next to buildings. We don't have the information on where the government itself is going to apply their actual store when they do apply. I'm not sure if the gentleman in the second row, if that was an actual government facility or a private run facility, but at the end of the day, they're probably not going to allow them side by side by side. I just think that everything should be taken into consideration in one foul swoop. Allowing all the retail to go, it should be open now. Sure, open it up. But if you open it up now with preference to, say, the Leaf Compassions and all the guys that have already, you guys have allowed them to build their brand for 2 years illegally, well, just now opening it up to the public. No problem, no gripes. I'm not going to start bitching about everything on the plate. But understand that that is a deciding factor for the fellows that are now faced with the choice. How am I going to operate? Black market or legal? Is this truly open to the public? Because if it is, just make it fair ball for everybody. And the federal restrictions on the buildings that can even be done, I'm not sure if anybody's actually noticed, but one of the things I saw was almost every dispensary, I believe, in town has a single door. Will this fall to Joe, the planner? Because most of the liquor stores have an entrance and an exit. We're going to need building upgrades. There's going to be a lot of stuff, right? You have to go in one door to buy your beer, out another door. All the dispensaries only have one door. You're going to require building code upgrades. You're going to require a lot of stuff, far more beyond just the, issuing the license. It's going to be going to your building department. It's going to go back and forth. So I'm not sure how the planning guys, if that's a city bylaw that requires the 2-door entry and exit. I'm not even really interested in the retail sales myself, but I may be forced there because if council decisions permit, we will not look at production sites for another 3 months, 2 months, 6 months. I don't know how long I kind of want to play those games with council either, right? I might just say, well, I might as well just jump on the, we'll get a liquor license. They don't make a lot of money. They don't express anything creative for me. I won't get creative. I won't get to do anything fun. I enjoy crossing genetics. I enjoy creating things that don't exist to make things better. I'm like a little scientist. Storefronts are fine and dandy. I don't see anybody trying to sell their liquor stores. They probably make a couple of bucks. But the entire industry revolves around more than just that. So just my last little 2 cents before you kick me out. Thank you.
Thank you. Before we close, I'll ask council if anyone has any further questions, but I have one question for our manager of bylaw. To clarify the process, when we get an application for an amendment to a liquor license, that comes to us, and then we reach out for public comment at that point, and then we either provide a supportive or negative comment or no comment at all. Will the process for this be similar to that? And if an application comes in and it meets our zoning and our bylaws, do we still have the ability to provide a negative comment, or does it meet our bylaws and so we don't really have a grounds to stand on to provide a negative comment?
Absolutely. Thank you, Madam Mayor. Absolutely, there is input. Each application received will be on a case-by-case basis, and like my presentation demonstrated, council can choose to make comments and recommendations, not make comments or recommendations, or simply approve or deny the application. So there is an opportunity where council can say, we'd like to consult the public and those affected, similar to a liquor license application, and you would put out for comments and receive feedback from either various staff departments like our CMP, like you typically do, or members of the community as well. If you do choose that option, you need to provide that obviously back to the provincial government. And there's also additionally, the province has identified there's cost recovery measures that local governments can charge back to the applicant for doing that process as well.
Thank you, that's very helpful. Are there any further questions from council? None. Yes.
Should I wait to ask the inspector any questions until we take it to a regular meeting, or is this the time?
I think you're welcome to, as long as he's fine to come up, you're welcome to ask the inspector questions.
Sure, he probably isn't, but come on up, Inspector.
We want to get as much information as possible.
Thank you. Inspector.
Hi.
Hi, my question is for you, with the cannabis businesses that are operating right now, have we had any issues, any problems? Has there been anything like that right now?
Your Worship, that's a big question.
Sure is.
There is no gray area. They are illegal. They always have been. And the regime turned from the Controlled Drugs and Substances Act to the Cannabis Act and the cannabis legislation in the province. They're illegal operations.
So at this moment, if anybody's under the assumed drug of cannabis, and you pick somebody up at a roadblock, can you tell, or is there a way of telling if somebody, other than smelling it?
So we're transitioning into impaired driving question?
With cannabis.
With cannabis. What we do is we have standardized field sobriety testing and drug recognition experts at the detachment. So we do roadside tests to see it's a myriad of all the drugs out there, and we can determine what drugs they're on, and then from them we can make a demand.
So my other question is, when can you give me an unpolitical answer for the first question? Is it when we have made a decision and you can talk more about it?
Well, I'm very clear. I think I'm the most clear police chief in the country. They're illegal. We've executed several search warrants, and as well on the first day of the new legislation, we visited the ones that chose to stay open, and they were provided a ticket for unlawful sale of cannabis.
So I'll wait and ask you again in the future. Thank you.
Sure.
There are some still open today.
Sorry, we're not allowing any more public input at this point, but we'll certainly talk afterward if you like. Do any other councillors have questions? Okay. Oh, Councillor Haggard.
While you're up here, can I ask you a pretty big question?
Absolutely. Whether it gets answered is different.
In your professional opinion, do you think the legalization of cannabis is going to help the drug issues that we have, or is it going to make them worse?
I support the legalization of cannabis. I support cannabis storefronts. I support that we get a regime in this community that's in alignment with the law, so we have regulations and ability to ensure that there's a safe production and a safe sale of cannabis in our community. I 100% support it.
Thank you.
Thank you. Okay. I think that is all.
Thank you.
We have a motion to receive the report from the Manager of Bylaw Services dated November 14th, 2018 that I will make. Would somebody like to second?
Second, Madam Mayor.
Second. Any questions on the report? All in favor? And then we do have a second motion, but I'm not clear if we should make this motion or leave it to the next meeting.
Madam Mayor, the motion is to refer the report that the Manager of Bylaw Services has provided to the next regular meeting. So at that point, Council can sort of further discuss and make recommendations.
Perfect. Would somebody like to move the second
I'll
motion?
move that, Madam Mayor.
Is there a seconder?
Second, Madam Mayor.
Great. All in favor? Thank you. And that brings us to the end of our agenda. Would somebody like to move adjournment? Second?
Second, Madam Mayor.
All in favor? Thank you.
Nice to see you.